Hello, we're here at the office of Simone Deliperi in Calgary, Sardinia. We've just completed a week's worth of training in the advanced field of biomedical dentistry. Simone has been an instructor at Tufts University in Boston. He's one of the world leaders in this field of tooth-conserving biomedical dentistry. He's done many papers and many protocols based upon scientific research. Simone, tell me, what is biomedical dentistry?
Biomimetic dentistry is a new science, dental science, that helps us to maintain the tooth structure. And this is possible also when teeth are structurally compromised.
Yes.
So we try to maintain as much tooth structure as possible. So it's a conservative science.
Very much so. Conservative, so less is best. The more tooth we save, the better it is.
Absolutely. This is our main goal. This is what actually patients ask when they come to my office. I can tell you a lot of stories
Yes.
of a patient that reject some aggressive therapies like full crowns because they want to preserve as much tooth structure as possible. So biomimetic dentistry is able not only to give you function but also aesthetics. So we can combine function, aesthetics and gingival health.
Very good. I think also one of the main advantages is you're trying to reproduce nature as close as possible.
Exactly. We are trying to reproduce nature. We are trying to build up our teeth in order to mimic the mechanical characteristic of both enamel and dentin. And also that area which is so important, which connects dentin and enamel, which is called the dental enamel complex.
Very much so. You're mimicking nature, you're saving tooth structure. What kind of training is involved in becoming a biomimetic dentist? Can anybody do this, or what's involved with that?
Well, it's a long way you have to go through because you need to go through a learning curve.
Yes.
Okay, you have to learn some basic principle on dental adhesion in order to select the right material to make your restoration not only an adhesive restoration but a biomimetic restoration. We need to mimic what the tooth, the behavior of the tooth during a function.
So we reproduce nature, we save tooth structure, we mimic it as close as possible. Great benefits to the patient, less is best.
Absolutely, and our main goal is to preserve the vitality of the tooth. So this is an approach that will allow you to save your teeth, because once your tooth is has a root canal, is weakened a lot. So by using the correct biomimetic protocol, you are going to avoid the root canal. You are going to avoid replacement of a crown. So we are trying to complete the so-called, that's the way I call it, the cycle of tooth preservation. Instead of having something that is destroyed, a tooth that is destroyed and weakened, we are trying to reinforce, to reproduce the original strength of the tooth.
What a great service. We appreciate you having us in your office, taking the time with your hospitality to train us all in these fields. The world is much better off for it. Keep on doing the good work and spreading the word. Simone's taken many hours of his own personal time and developed many techniques on his own to improve this field. So Simone, you are a pioneer. Thank you for doing that and putting it out here for us to learn.
Thank you very much. Thank you very much, Jim, for being part of this group.
My pleasure.
And for your commitment.
Been a great pleasure.
Thank you.